Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are going to do some role play sessions, especially for nurses. And Grandmaster class sessions are a part of classical corrections from Seven Sentinels. I am Peter Simon, the English language doctor, and these role play sessions, role play number 1. This is the role player's card number 1 for nursing profession. This is for the role player, the patient, and that is for the interlocutor. And I'm going to play this role of an interlocutor. And this is the role play card for the nurse. We have Elizabeth in front of us. Azubuike Elizabeth from Obosi, Anambra, Nigeria. We are doing the role play. Hello, Elizabeth.
Hello.
Yeah, this is the role play. We are going to start. It is a one-on-one role play session. And this is the role player card. I'll be placing it for your requirement whenever it is necessary. Fine. So this is, once again, Elizabeth from Nigeria. Speaking role play 1, diabetes, insulin injections. Nurse, Elizabeth, you can start now.
May I know your name, please?
Yes, nurse, you have to speak a little loudly.
May I know your name, please?
My name is Abraham Lincoln and you can call me Lincoln.
Okay.
Yes, you can start now.
Good afternoon.
Good afternoon, nurse.
I'm Nurse Elizabeth. Am I in the house of Mr. Lincoln?
Yes, nurse, please come on in. Have your seat. This is my house. Yes, please.
With the use of oral glycemic agents and diet. So that's why I'm here to home visit you. All right, Mr. Lincoln.
Can you repeat this, please?
Good afternoon.
Good afternoon, nurse, please.
I'm Nurse Elizabeth. Am I in the house of Mr. Lincoln?
Okay, nurse, come on in. This is my house and I am Abraham Lincoln. Come on in, have your seat.
Thank you, Mr. Lincoln. I was sent by your general practitioner to home visit you and teach you on how to self-administer insulin. Is that okay?
Yes, nurse, absolutely fine.
Okay. Recently, your sugar level has not been controlled with diet and oral medication. That is the reason why I'm here, to teach you on how to give insulin to yourself. All right?
Yes, nurse. And I want to ask you one thing, nurse.
Okay.
I am managing my diabetes well with my diabetes medication, diabetes diet, and exercise regimen. Everything is going on smoothly and I have no complications. And so fine, then why does this doctor want to change my medication plan? Can you please tell me?
Okay, Mr. Lincoln, I understand your concern towards this, but why the general practitioner sent me is because of recent, your sugar level has not been controlled. It has been on high level with the medication and diet. So that is why the use of injection is necessary so that it will bring it down. Okay?
Yes, nurse.
So, Mr. Lincoln, can you tell me how you feel about this injection?
Nurse, actually, I am not interested in these insulin injections because I'm scared of injections. Please tell me if there is any other possible way to manage my diabetes other than these insulin injections.
I'm afraid, Mr. Lincoln, for now, there is no other way because you have been using your diet and the medication and it has not been controlled. So that's why the doctor changed it to injection. Please don't, I understand that you'll be afraid, but don't worry. It's not a painful thing and I will teach you on how to do it, okay?
Okay, nurse.
Is there any concern you want to tell me before we proceed on how to?
Yes, nurse. If there is no, I can understand that there is no other possible option. So you can go ahead and explain me the procedure of taking the injections.
Okay, thank you, Mr. Lincoln, for giving me such an opportunity. You see, the procedure of giving injection, first of all, you will clean the area you want to give. Which are the areas? The area is your thigh, the upper part of your thigh, then your abdomen below your belly button, 2 inches from your belly button, then your upper arm. Please, when you want to give the injection, ensure that you rotate the area so that you will not have reaction. And when you finish giving the injection, please, Mr. Lincoln, don't massage it so that the absorption of the insulin will not be impeded. Okay?
Okay, nurse.
Is there any question you want to ask me, Mr. Lincoln?
Yes, nurse. I want to ask you one more thing. Should I change the place where I take the injection regularly, or should I use the same place?
Okay, Mr. Lincoln. Before you take the injection, please ensure you clean the place and make sure that you change the area to avoid irritation and swelling. Because when you continue using the same area, it will cause thickened skin and that place will swell, okay?
Okay, nurse.
Do you have any other concern, Mr. Lincoln?
Yes, of course. And I want to ask you one special question. I am not a nurse and I am not, I do not have any experience before. So how is it possible that I take these injections? If anything goes wrong, then what am I supposed to do? And I also want to know if there will be any side effects for these insulin injections.
Thank you, Mr. Lincoln. Your question is understandable. You see, there is no side effect concerning this injection. And when you want to take it, please make sure that you have eaten, okay? Or
Okay,
you have
nurse.
your food by your side. Then I will issue you a leaflet which will give you the details of how to take the injection. And I don't mind if you call me for any question, okay?
Okay, nurse. I definitely understand. And what about the used syringes? Can I use them again or should I throw them off?
Okay, Mr. Lincoln. You see, because you are in your house, there is no safety box with you. So I want to encourage you, if you can get a container that is space-proof, that has small opening. Anytime you take the insulin injection, you put the needle and syringe inside it. Please don't reuse it. It's just per single that you use it, okay?
That's very fine, nurse.
Then when it's filled up, please contact me. I can dispose this for you properly, okay?
Yes, nurse, definitely I'll do that. And thank you very much, nurse, for all the suggestions you have given. That was really very nice. Thank you once again.
Thank you, Mr. Lincoln. But before we round up, I want to summarize by telling you that it's not a painful thing, okay? Other people have been taking it and I happen to take it too. Then when you finish taking the injection, please make sure that you put it in the lead so that it will not injure you or any other person around you. Another thing, try to rotate the area you are giving injection to avoid reaction like swelling or thickened skin. Okay.
Right. Yes, nurse. Thank you very much. Have a nice day. Bye-bye.
Thank you, Mr. Lincoln. I wish you quick recovery.